Well, the subcommittee will come to order. I want to welcome our witness, Acting Director Botticelli. This is the first time he's appeared before the Appropriations Committee, and I appreciate you coming here to testify, and thank you for your service. The Office of National Drug Control Policy is charged with the extremely difficult task of coordinating multiple federal agencies' efforts to address many different drug-related issues at home and abroad. In addition, you administer some of the very effective drug prevention and enforcement grant programs. And today, the committee will examine the Office of National Drug Control Policy's fiscal year 2015 budget request, along with your efforts to develop and coordinate our nation's drug policies. The budget request submitted by the President has some interesting priorities within this subcommittee's jurisdiction. And while the administration is requesting an increase of over $1 billion for the IRS and an increase of over $500 million for the GSA, the administration has recommended a decrease below enacted fiscal year 14 for the high intensity and drug trafficking areas program and the drug-free communities program. Now, both of these are drug prevention and enforcement programs. They're to mobilize communities and increase collaboration among community law enforcement, and I can say that specifically they have a really good impact in my district down in Jacksonville, Florida. And so I would typically applaud proposed reductions in federal spending, but it makes me wonder why these drug prevention and enforcement programs are being reduced, because recently the Attorney General announced that heroin overdoses are, he said, quote, urgent and growing public health crisis, end quote. States are telling our children that marijuana use is okay by decriminalizing recreational marijuana. Our nation's problems with cocaine, meth, and prescription drugs certainly haven't gone down any. And so I find it a little hard to believe that the administration feels that efforts to keep drugs away from our children and out of our communities should be reduced while proposing increases for the bureaucracy of the IRS and deciding to build new federal buildings. As the agency is charged with developing our nation's drug policies, you have the difficult assignment of ensuring that not only the Department of State, the Department of Defense, Department of Justice, Department of Homeland Security, the Department of Health and Human Services, and numerous other agencies are all working in coordinated manner to address our highest priority drug concerns. And I look forward to your testimony today on how the Office of National Drug Control Policy is leading these efforts on this coordinated role. More specifically, we have heard concerns that the Food and Drug Administration doesn't always take law enforcement's concerns with prescription drug abuse into account when approving new prescription pain medication. We've also heard concerns that reductions in military spending could significantly reduce counter-narcotics activities in Latin America, and that increases the availability of illegal drugs in the United States. And I hope to hear in your testimony today what you all are doing about some of these major concerns. Our nation continues to fight a drug problem that takes lives, brings about violence, and harms our communities and families, and I know that you and your staff are working hard to keep our country safe and healthy. So once again, Acting Director Botticelli, welcome. I look forward to your testimony, and with that I'd like to turn the microphone over to my colleague, Ranking Member Serrano.
Thank you, Mr. Chairman. I also would like to join you in welcoming the Acting Director of National Drug Control Policy, Michael Botticelli. I love that name. He used to be the second baseman for the Boston Red Sox. The Office of National Drug Control Policy's mission places it at the forefront of federal drug policy and the intersection of several federal agencies, such as the Department of Justice, Transportation, State, and the Treasury. The fiscal year 2015 budget request for ONDCP is approximately $311 million, a decrease of $55 million from the fiscal year 14 funding level. This will hopefully be targeted towards improved coordination and oversight of interagency drug control programs and policies, something I continue to be concerned about with regards to the agency. This issue is particularly relevant in light of the Attorney General Eric Holder's recent proposal for reduced drug sentencing. I hope we will be able to discuss this issue so I can better understand your role in these efforts and learn what you're doing to reform some of our criminal justice policies with regard to drugs. I also continue to be interested in the development of a Caribbean border counter-narcotics strategy. The fiscal year 2014 Consolidated Appropriations Act included language requiring your agency to develop a comprehensive Caribbean border counter-narcotics strategy, just as you have done for other U.S. borders. I believe this is not only an issue of parity, but extremely critical because of increased drug trafficking in the region. It is essential that Puerto Rico and the Virgin Islands are integrated into federal counter-narcotics strategy. I look forward to discussing these and other issues with you in detail. Thank you for your service and for appearing before us today.
Thank you. Chairman Rogers wanted to be here today, but he could not be here and sends his regards. And so without objection, I'll make his statement part of the record. And so now, Acting Director Botticelli, I think about art when I think about Botticelli.
Art?
Art.
Okay. Okay, so he's an opera singer for the Boston Red Sox.
Okay. But anyway, if you could keep your remarks to about 5 minutes or so, that'll give us time for questions, and then your entire statement will be submitted for the record. So, Mr. Botticelli.
Thank you. Chairman Crenshaw, Ranking Member Serrano, members of the subcommittee, as indicated, my name is Michael Botticelli. I'm the Acting Director of the White House Office of National Drug Control Policy. I am pleased to appear before you today to discuss the administration's fiscal year 2015 budget request for ONDCP, part of the Executive Office of the President. ONDCP was created by statute in 1988, and November 2013 marked our office's 25th anniversary. ONDCP establishes policies, priorities, and objectives for the nation's drug control program. The goals of the program are to coordinate the federal government's efforts to reduce illicit drug use and its consequences, including drug manufacturing and trafficking, drug-related crime and violence, and drug-related health consequences. To achieve these goals, the Director of ONDCP is charged with producing the administration's national drug control strategy and ensuring executive branch agency drug control budget spending supports the strategy. The administration's strategy, first released in 2010, is based upon input from public health and public safety professionals across the country and on decades of research from the nation's top scientists that demonstrate that addiction is a brain disease, one that can be prevented, treated, and from which one can recover. ONDCP also has responsibility for working with our national and international partners to develop the National Southwest Border Counter-Narcotics Strategy, the National Northern Border Counter-Narcotics Strategy. In FY 2014, enacted budget also contained a directive for ONDCP to develop a Caribbean Border Counter-Narcotics Strategy, which is now in process. Our nation faces a number of substance use challenges. For instance, there is an epidemic of opioid drug abuse in this country. Drug overdose deaths driven by prescription painkillers surpass homicides and traffic crashes in the number of injury deaths in America. Heroin use remains relatively low in the United States as compared to other drugs, but there has been a troubling increase in the number of people using heroin. Evidence suggests that some users, specifically those with chronic opioid addictions, will substitute heroin for prescription opioids, since heroin is often cheaper than prescription drugs. A recent report from the Substance Abuse and Mental Health Services Administration found that while only 3.6% of people who had started using prescription drugs non-medically ever initiated heroin use in the following 5-year period, 4/5 of recent heroin initiatives had previously used prescription pain relievers non-medically. These findings demonstrate that we need to take a comprehensive approach to addressing opioid drugs, including more widespread use by first responders of naloxone and emergency opiate overdose reversal medication, as well as expanded access to medication-assisted treatment. Further, multiple studies show that young people's attitudes towards marijuana use and non-medical use of prescription drugs are softening. Each day, an estimated 4,400 young people under the age of 18 initiate drug use for the first time. This can have a profound effect in the future, since research shows us that the earlier a person begins to use drugs, the more likely they are to develop a substance use disorder. To enable ONDCP to accomplish the administration's goals to address these and other numerous challenges from substance use disorders, the President is requesting $311 million for FY 2015. This request represents a decrease of $55 million from ONDCP's FY 2014 enacted budget. However, it has been developed to ensure that we have the resources to meet the strategy's goals while reducing spending. ONDCP's budget requests include funding for 2 grant programs that support efforts throughout the nation to reduce drug use and its consequences. The Drug-Free Communities, or DFC, support program provides grants to local drug-free community coalitions to prevent and reduce youth substance use. Directed by ONDCP in partnership with SAMHSA, the DFC program provides grants to local drug-free community coalitions, enabling them to increase collaboration among community partners and to prevent and reduce youth substance use. During FY 2013, a total of 643 DFC grants were awarded. The President's request for DFC grants program is $85.6 million, a decrease of $6.3 million from the FY 2014 enacted budget. The High-Intensity Drug Trafficking Areas, or HIDA program, helps improve the efficiency and effectiveness of drug control efforts by facilitating cooperation among federal, state, local, and tribal law enforcement, as well as other drug control organizations. The President's request of $193.4 million for the HIDA program is a decrease of $45 million from the FY 2014 enacted budget. However, this request maintains the HIDA's program focus and mission of reducing drug trafficking and production. Core functions will be maintained. In addition to ONDCP's responsibilities to develop and implement the strategy and administer its grants programs, the office is responsible for coordinating, overseeing, and evaluating the effectiveness of agencies comprising the National Drug Control Program throughout the federal government, as well as overseeing the consolidated National Drug Control budget to ensure the drug control funding proposed by these agencies is adequate to carry out the strategy. The President's FY 2015 National Drug Control budget request is $25.4 billion government-wide. This represents an increase of $151 million over the FY 2014 enacted level. Reflecting the need to address both public health and public safety, the portion of the budget requested for drug treatment and prevention efforts, 43%, has grown to its highest level in over 12 years. I'd like to thank you for the opportunity to testify, and I'm happy to answer any questions that you might have.
Well, thank you very much. Let me start by asking, you mentioned HIDA was going to be reduced by $45 million, and I mentioned in my opening remarks that it seems like a kind of a strange sense of priorities when you ask for $1 billion for the IRS and $500 million to the General Services Administration, and yet the last couple of years the funding for HIDA has been reduced in the proposed budgets, but Congress each year has restored that funding. And again, in today's world, when states are legalizing marijuana, poppy production's up in Afghanistan, cocaine, heroin use, all that stuff. What do you think the impact would be if you were to reduce it by $45 million?
Clearly, Chairman, the HIDA program is really essential both at the federal, state, and local level in terms of being able to enhance efficiency and information sharing among law enforcement entities. We consider that an incredibly valuable program. Our challenge was within restrained resources, making sure that we maintain core functions and core services with our HIDA program. So to that extent, this will not result in any elimination of any of our HIDA programs. It will maintain its core mission and core functions. The biggest, I think, impact will be on the HIDA's ability to address emerging drug threats that we see in the community. So it will preserve the core functions and preserve our core HIDA infrastructure.
So in your opinion, that's still effective, the things that you're doing. It's just a matter of not as much money to go around, but as you know, the last couple of years, Congress has restored that funding, and so you wouldn't be upset if that happened again.
We see our HIDA programs as incredibly valuable programs, and one of the things that, as over the past year, that I've seen with our HIDA programs is their ability to be flexible and nimble at the state and local level in terms of really responding, I think, to local threats and local emergencies.
Gotcha. Another question, just briefly, that you have this drug-free community program, and I think there are like 600 coalitions across the United States. They work on mobilizing communities and increase collaboration, things like that. How do you measure the progress that's being made by those community groups that those are grants, they receive your funds? I mean, how do you go about deciding who's effective, how effective, things like that?
Sure. So one of the things that I think we know is that local drug use patterns are different among localities, and what it requires to really reduce substance use at a local level is really looking at those community factors, but also convening all of the local stakeholders, law enforcement, health and human service agencies, schools, to really look at implementing evidence-based prevention program at the local level. As you indicated, for FY14, we're estimating that we're going to have 672 of those local coalitions. They have been nationally evaluated, and it's been shown that those communities that have drug-free communities programs are able to substantially reduce drug use in their communities. So these are programs that are implementing evidence-based prevention programs and are also nationally evaluated and have been shown to reduce substance use among youth at the local level.
Well, those funds are being reduced or proposed to be reduced. How would that impact your ability? Would you give less grants, or would the grants be smaller? How do you handle that reduction?
Sure. So at this point, it doesn't mean that we would take back any existing grants. So those grants would continue through the grant cycle. What it would mean is that we'd probably be able to award 50 less grants in FY15 compared to what we're estimating for FY 2014.
How much do you think it would take to continue to fund the number of grants that you've funded in the past?
So in terms of looking at kind of level funding in terms of FY14 enacted, that's approximately $92 million for the program, and with other, it's $92 million.
Gotcha. Well, thank you. Mr. Serrano?
Thank you, Mr. Chairman. That was going to be my first question also that you asked, so let me just, I don't know if you got the number the same way as I see it. It was not you, but Mr. Botticelli. You said 672. That's what it is now. It will be reduced to 614, am I correct?
That's correct.
Okay, and you spoke about spreading the money around more? Because, see, that's a program that seems to be working. So we're wondering why the administration would want to cut or propose a cut. Mm-hmm. And I think you're hearing something, unless I heard it wrong, some things that you usually don't hear from all members of a committee, and that is asking the question, how can you continue to function at a level that does credit to a program that obviously works and that has the support of many members of this committee?
Clearly our drug-free communities program is one of the backbones of our prevention infrastructure in the United States. It's an incredibly valuable program to us. Obviously, we had to look at how do we have restrained spending in FY 2015. Again, I think the proposal, if enacted, would be that we wouldn't eliminate any of the existing grantees. It just would mean that we'd have about 50 less new grants in FY 2015.
So you don't think it will be a result of reducing from 672 to 614? Because we went by those numbers. There would be a reduction to 614 or not?
So it would be an overall reduction, but it does not mean that we would eliminate any existing grantees. So that money would continue. It just means that we would have less money we would be able to award 50 less grants, new grants in FY 2015.
Okay. Let me ask you about the Caribbean Border Counter-Narcotics Strategy. Now that was, as you mentioned, language that was put in the bill at the request of many of us, including the resident commissioner from Puerto Rico, Mr. Pierluisi. Mm-hmm. And, this issue speaks to two situations, and a lot of the Florida members can speak to it. And that is that, first, the territories get less attention than the states. But most importantly, in this case, that we're, shooting ourselves in the foot by allowing one border, if you will, to be totally open. Not only to enter the territory, but then to make it to the mainland, as we say. So it's both setting this one up, and I want to hear your thoughts on how quickly that could be set up. Setting this one up not only helps those two territories from having the drugs come into their area, but then it helps the states, especially Florida, with the drugs coming into the states.
Great. Clearly, our ability to interdict drugs, particularly in the Caribbean, is really core to the strategy. And as you indicated, the more drugs that we can intercept and interdict, the less that we have coming to our local communities. And clearly, having a Caribbean strategy, I think that supports the work that we're trying to do domestically is particularly important. So we have made progress in terms of the development of that Caribbean strategy. So we've already convened meetings across our interagency looking at how each of our relevant federal interagency partners can support the priority action items of the Caribbean strategy. So, and we continue to work with them. And so that strategy is in progress, and we hope to have that to you shortly.
Well, I hope so, and I know we have other members, Mr. Chairman. I just want to make a statement for the record, and that is something I've said over and over and over again in my 24 years in Congress, that anytime drugs enters one of our territories, it has in fact entered the United States. And a lot of people see it as it didn't enter the United States until it gets to Florida or to Texas or to New Mexico. Not true. If it enters any territory under the American flag, it entered the United States, and it should be fought in the same way it's fought when it enters one of the states. And I thank you for your reply.
Great, thank you. And I was just handed a note. We actually have staff who will be meeting with your staff on Friday to be updating you on our progress to the strategy.
Thank you.
You're welcome.
Thank you. Mr. Womack.
Thank you, Mr. Chairman. Thank you, Mr. Botticelli, for your testimony here today. I want to confine my remarks initially and my questions on weed, because there's certainly been a lot of discussion about it from the medical side of the equation to just the outright legalization for recreational use, and I have my own pretty hardcore philosophical objections to what's going on around our country. But my question is as far as the ONDCP is concerned, help me understand what involvement your office has had with states like Colorado et al. that have gone in this direction in helping educate people on what the true effects of this increased use happens to be.
Sure. I think you know that the Office of National Drug Control Policy and the administration has remained opposed to drug legalization. And I think we come at this from a public health standpoint, particularly as it relates to what we think the impact will be on our youth. You've raised, I think, some pretty important concerns. We now have more 12th graders who are using marijuana than are smoking cigarettes, and their perception of risk is at the lowest level that it has been since the 1970s. And we know that generally when youth perceive something as less risky, they are more likely to try a substance. Clearly, we have been concerned in terms of what the impact will be, particularly in Colorado. But not only that, what is the message that sends our youth nationally in terms of what it means to use marijuana? We have been engaged following on the Department of Justice criteria with both Colorado and Washington, as well as with our federal partners, to really monitor both the public safety and public health impact that legalization will have in Colorado and Washington in terms of the transportation of marijuana from one state to another. Are we going to see increased prevalence in use among our youth? We've been engaged with governor's offices of both Colorado and Washington, as well as the health departments in Colorado and Washington, to basically see how they are going to implement regulatory schemes to ensure that they're doing everything possible to mitigate both the public safety and public health impact of legalization efforts.
So you've weighed in, your office has helped try to educate the country on this particular subject, and do you anticipate that there might be a more a bigger or higher response, a larger response, a more weighted response toward what we see going on around the country?
Again, I think what we've generally tried to do is with our existing resources that we've had, both within our drug-free communities and our other resources, to how do we continue to highlight prevention efforts, particularly as it relates to things like alcohol and marijuana. And our drug-free communities have really been important resources that we've had to really heighten the prevention messaging that we need to really counteract some of the messages that youth are getting in terms of the perceived safety, if you will, of marijuana.
Now, there's no way we can put a crystal ball in front of you to kind of look into the future. If there was a crystal ball in front of you, do you anticipate having to reach back to, say, Colorado, as an example, since I've already mentioned them, and have one of these "I told you so" moments?
What the Department of Justice has laid out in terms of their federal law enforcement priorities was a clear indication that they reserve the right to take subsequent action if Colorado and Washington haven't demonstrated their ability to meet those criteria as it relates to public health and public safety. I think we have, as a public health person, I think we have every reason to think that we're going to see some problems in Colorado and Washington. And again, usually the data and science suggest that if, as youth see something as less harmful, that there will be a correlational increase in terms of their youth. And I think that's what we're seeing nationally. So I do think that we have some concerns, both in terms of Colorado and nationally, in terms of looking at the data that we have now, but also what that means going forward.
Finally, Mr. Chairman, if I may, I've a subject that's near and dear to my heart. We've talked about it in previous hearings on this particular subject matter, but I've experienced this in my own family, so I think I'm not a subject matter expert by any means, but I am a parent and now a grandparent, and it scares me, the message that we are sending to future generations out here, and I'm not saying the office is sending, I'm just saying the message the country is sending, that some of these things that we know with empirical data are putting our kids on a bad path, that we're now saying it's really okay. Look at what's going on in Colorado and Washington. Legalization, that we are basically promoting almost in some categories, we are almost promoting the fact that this is something you can do without any known consequences down the road. And I'm deeply worried about that as a parent, now as a grandparent, and certainly as a member of Congress, whose job it is to look out for the welfare of this country. It doesn't require a response. You just wanted to say that and let you know that it has my attention. I yield back my time.
Thank you. Mr. Diaz-Balart.
Thank you very much, Mr. Chairman. Thanks for being here, sir. You were very clear about your statement about your concerns, right, of use and expanding use of marijuana. And going to the statement that my colleague just mentioned, that mixed message, by the way, is not only heard in the country, it's also heard from our allies. You have, I get it all the time when I travel abroad to Latin America. Our allies, those who are putting the resources and the blood to try to stop drug production, constantly are asking me this, why are we doing this if in the United States there's this kind of a mixed message? And so your message today was very clear. Let me ask you a simple question. Isn't marijuana outlawed by federal law? I mean, I think it is.
Correct.
Okay, so here's the question. Have you asked the Attorney General or the President to just enforce federal law? In other words, I understand you have serious concerns. Your job is to protect the people from drugs, including marijuana, that you have serious concerns about. Have you asked the administration to just enforce federal law? Because if it is so problematic, which you have said it is, and we all have our opinions on that, but clearly, you're an expert on this, and you speak for the administration on this. Have you asked the President to enforce federal law? Have you asked the Attorney General to not just sit back and wait to see what happens in Colorado, but to enforce current federal law?
I think what the Department of Justice has stated is that given limited federal law enforcement priorities, that they're going to reserve their federal law enforcement actions at the most significant crimes associated with marijuana and not go after people who are using it for personal use. But again, I think that they've reserved the right to go back.
But have you asked the Attorney General or the President, have you said this is a big issue, this is an important issue, you see it as a health hazard, you see it as a problem, you mentioned the name, clearly we're spending a lot of money, as we should, to try to make sure that kids don't smoke tobacco. I don't want my kid to smoke tobacco. And yet, have you asked, has that been one of your priorities? Have you said to the Attorney General and the President, I think this is a bad idea, I think this is dangerous, I think this is harmful, and I think we should enforce federal law?
During the course of the development process, obviously we had the opportunity to talk to the Department of Justice in terms of those issues. I think what we've agreed to going forward is, again, given what the Department of Justice has issued, an engagement with the Department of Justice to monitor the data at the federal, local, and state levels to see what the impact is, give that information to the Department of Justice with their opportunity to look at taking subsequent action should we see enhanced public safety and public health effects as it relates to Colorado and Washington.
So it's kind of a end-around question, and I'm not going to further press you because I don't want to put you at odds with the administration. However, it seems to me that part of the mixed message is coming, frankly, not from you, sir, but from the administration, because we have you saying this is a bad deal, this is bad for public policy and public health, and then you have, frankly, the Attorney General and others saying, we're going to monitor it, we're going to see how it goes, it's not that dangerous. I saw the President saying, yeah, it's probably not healthy, but it's not that bad. And I'm paraphrasing, please don't quote me on that one. It's not a direct quote nor inaccurate, because I was paraphrasing it. So again, those are the mixed messages, by the way, that our allies are constantly complaining about, that we are giving mixed messages to our allies. We're also giving mixed messages, I think, to the American people. And I think I would like, for one, sir, to have what is the policy of, what is our policy? Is marijuana illegal? Is it harmful? And if it is, what serious concrete steps? And to the point where we should continue to press our allies around the world, particularly in this hemisphere, to do what they're doing in this very painful battle against it. And if not, what should the policy be? And I think that mixed message is something that I hope you all kind of take back and realize that it's there, not only for the American people, for our allies. Second point, if I have any time, Mr. Chairman, going back to Mr. Serrano's question, and I commend him for always bringing that up. Recently, for example, I mentioned how our allies are confused at best as to the mixed messages that are coming from the administration and from the states, and it's not only the administration, from the country. But then you have others who do not have mixed messages. You have the head of the Ecuadorian government, Mr. Correa. They've kicked out the DEA out of the country. In Bolivia, Evo Morales has said, that clearly that he said that their country is better off without the DEA. General Kelly, who's the commander of the Southcom, by the way, located in my congressional the district that I represent, he recently testified in front of the Senate Armed Services Committee that, and he was very blunt, that he believes that we're currently only stopping, and I know that Mr. Serrano, this is not going to shock him, but it's not going to please him, only catching about 20% of the drugs being trafficked into the United States. And it's an issue there of resources. How much coordination, do you have coordination with Southcom? And as far as on the budgetary aspect of it, how much coordination is there? Are you consulted at all? What's that role?
Sure. As part of our statutory authority in terms of looking at the totality of the drug control budget, clearly we work with DOD, the Coast Guard, and others in terms of our interdiction, our part of our ongoing supply reduction strategy. I actually had the opportunity to go down to Southcom and to talk to General Kelly and to see some of the work that he's been doing and hear some of his concerns. This is obviously, interdiction is part of our core supply reduction strategy, and we consider it very important, and we has been a significant amount of discussion both with General Kelly as well as the interdiction community through our interdiction committee work to look at available resources, to look at operational efficiencies that we can achieve in terms of meeting our goals of interdicting as many drugs as possible. So clearly, we have been taking a leading role with the military and with all of our interagency partners to look at, in light of the fiscal issues that we have here, how do we continue to meet our goals around supply reduction and interdiction.
And that's one that we can get a big bang for the buck.
I would agree. I think that when we see large-scale removal of drugs that don't come into our country, we know, again, from a prevention perspective, that the more drugs that are available in the community, the more likely that we have people are likely to use them. So clearly, these are complementary strategies, both in terms of our supply reduction and demand reduction strategy.
Thank you.
So they're important goals.
Great, thank you, Mr. Chairman, for allowing me. And if I just very briefly also, Director, again, that mixed message is really intense and it's real deep. And I don't want to bust your chops, but I think we've heard it here today.
Great.
I mean, we really have. I mean, you've been clear about the effects and what your concerns are. On the other side of the same administration, there's the lack of willingness to enforce current federal law. Now, if the federal law is wrong, and if marijuana is not a big deal, and then we should have that discussion, and the president should be up front and say, let's debate that. But right now, what we're getting is mixed messages, and I think our allies hear that. Those who are fighting narco-trafficking and drugs are hearing that, and our kids are hearing that, and that's probably even the most dangerous part.
To be fair, Congressman, I think both the President and the Department of Justice have indicated their significant concern around the public health impact. So I think we have to clarify law enforcement issues versus public health and public safety. But thank you for your comments.
Thank you, sir. Thank you, Mr. Chairman.
Thank you. Mr. Graves.
Thank you, Mr. Chairman. Mr. Director, thanks for being here, and thank you for what you do. I couldn't imagine the burden that you carry each day on your shoulders, and it's a very noble cause. And I know that we have our questions and concerns and such, and I didn't really intend to speak on the topic that the two gentlemen before me had, but I was shocked at the statistic that you shared momentarily. It's in your statement. You said it here as well, that more 12th graders today now smoke marijuana than cigarettes, and I think we were all shocked to hear that. And I heard about mixed messages, and you suggesting that it's because they sense that marijuana has fewer consequences than cigarettes. And it was just less than 60 days ago the president, I think, sent some confusing messages to the youth across the country, and his quote was well documented, and he even says, as it's been well documented, I smoked pot as a kid. And I view it as a bad habit and a vice, not very different from cigarettes that I smoked as a young person, up through a big chunk of my adult life. And this was in the New Yorker. And you thought he would stop there, but then he said, I don't think it is more dangerous than alcohol. And, I mean, that probably bothered you, I would imagine, because I know you take your job very seriously. Does that make your job easier or more difficult? And did you just, with some sort of internal frustration, go into the president's office and say, what are you doing here? You're making my job extremely more difficult and challenging. What was your response to that? Could you share that with the committee?
I think if you look at the totality of the president's comments and subsequent comments that he made, I think that a lot of what he was referring to is some of the inequity and disparities in sentencing that we see for marijuana. Particularly among people of color, which is an issue obviously not just for our office, but for him and the Attorney General's office as well. So, I think the President has repeatedly
Do you
raised...
suspect that's how the youth interpreted his comments? And maybe you're right, in totality, that's what he was thinking and suggesting, but the youth of our country, I think they probably heard, I don't think marijuana is more dangerous than alcohol. And almost, it's just an odd statement and such.
Again, I think, I go back to looking at some comments that he made subsequent to those in terms of really understanding the significant public health consequences, both for alcohol and for marijuana, and not necessarily endorsing what was happening in Colorado and Washington and saying that we really have to be vigilant in terms of keeping this as a public health priority. So.
And I don't mean to interrupt, but I mean, I took it as a little flippant and how he off the cuff, and maybe he was caught off guard with that question and wasn't prepared, but he is the President of the United States, and I know that he gets difficult questions all the time, and this one couldn't have been all that difficult. But has he since then come forward and with remorse said, I made a mistake. I shouldn't have done that as a youth, and just as all of us at some point have done things that we regret. Has he ever expressed any regret for that, or did he just allow the comments to hang and dangle, and everybody hoped it was about sentencing?
No, I think that he made some subsequent comments after that relative to understanding that this was a significant public health and public safety issue. The president is not unlike many parents who used substances in their youth to great regret. And I think the best thing that we can do is be honest and candid about it and say that we don't support that for our kids, as he talked about, and not supporting it for his daughters. So, I think if you look at, again, successful prevention strategies, we need to have those conversations, and we need to be candid as parents, and we need to say to our kids, look, I may have done this and I may have done okay, but I don't advise it for my kids. And
I appreciate his candidness and such, and I hope he has taken a statement and suggesting his regret and not encouraging others to do that, and not a statement in which he was saying, I did that and look at me at what I've been able to accomplish in life, but instead take another position that it was a mistake. If I could change gears real quick, I met with some sheriffs last week while I was in the district, and we were talking about methamphetamines, and obviously it's been a very difficult problem in our region in northwest Georgia. Mm-hmm. They were suggesting that with all the steps we've all taken to try to prevent it, that things have changed, the ingredients are changing, obviously others are finding easier ways to do it, but there's still that lingering problem with drugs coming across the southern border. Mm-hmm. Do you sense that our border security is adequate when it comes to not only from the illegal immigration perspective, not asking you to speak on that, but from a illegal drug perspective crossing our borders? What can be done? Is it adequate, and what more can be done?
I think you've raised two critical issues here, both one in terms of drugs coming in from Mexico and domestic production as well as domestic youth. And so I think we've had significantly enhanced the resources at the border. Part of our concern has been both good and bad, in the sense that they have been able to actually seize a tremendous amount of more drugs at the border. Unfortunately, we have seen about a 500% increase in methamphetamine seizures at the border. And I think you're absolutely right that as Mexico has changed in terms of looking at putting controls on precursor chemicals, as the Combat Meth Act and states have enacted, we see different patterns emerging in terms of both production internationally as well as domestically. So previously, where we saw large labs here in the United States, I think some of our laws have made it much, much harder to get large amounts of chemicals, and we're seeing the increase in terms of these very small one-pot labs, particularly here in the district. We've all heard news around that. So it's been clear that this is a public safety and public health issue that we have to look at. One of the areas that we're examining is we have made some pretty good progress over the past few years in terms of the reduction in methamphetamine use here in the United States, I think largely through our drug prevention and local law enforcement efforts. So we do have a number of programs through our office that help support reducing the distribution and trafficking, largely through a component of our HIDA programs, as well as work through our drug-free communities. So meth is an issue that we have to continue to look at both internationally as well in terms of what we seize from the borders, but also work on domestic production and domestic trafficking, as well as reducing demand for methamphetamine here in the state.
And I know it's outside of your scope, but from the trafficking, drug trafficking across the border, are you suggesting that adequate protections are in place now? Is there more that can be done? Any thoughts on that? Or are you pleased with the effort there? Because ultimately it impacts your role and what you do and have to handle.
I think we've done a significant job in terms of looking at increasing our technology, increasing our information sharing, as well as increasing some of our prevention efforts on both sides of the border. So I think we actually have done a really good job in terms of looking at that. There's always more work to be done. My former boss is now the Commissioner of Customs and Border Protection, so I am sure that we'll have a very good relationship in terms of Customs and Border Patrol, and particularly as it relates to our southwest border.
Thank you. Thank you, Mr. Chairman.
Thank you. And I share your concern, as well as I think everybody on subcommittee probably is concerned about marijuana and to hear the things that you mentioned. But I guess the good news is that we can refer everyone to Governor Jerry Brown out in California, who I think said it very succinctly when he said it's hard to have a great state or great nation when you got too many people getting stoned, which surprised me to hear him say that. But that's the other side of the coin that probably people need to talk about. I think he talked about you shouldn't have too many potheads. So he's trying to spread the message, I guess, from the other side of the coin. Let me ask you, we got time for a couple of more questions, and if members have, but I want to ask you on an international scale and then more domestic, but people have talked about Latin America, the Caribbean, the fact that 75% of everything comes through. On the other side of the world is a place called Afghanistan where they grow poppies. And I remember the first time I went to Afghanistan, there was all the conversation about how are we going to get people to quit growing poppies and grow something else. And that kind of died down. I mean, there was a lot of discussion about that. I was there about 6 weeks ago, and the military was talking about all the great things that have happened in Afghanistan in terms of education, in terms of universities being created, women's rights, women's voting. We didn't really talk much about the whole poppy situation. Then, as we prepared for this hearing, it was called to my attention that the poppy production is just ever increasing. Now it's 5% of the GDP. And I wonder, because you see the impact when these drugs, whether from out Latin America or Caribbean or whether from Afghanistan, when they kind of hit the ground here, the terrible impact they have. Do you work with them, and are those things that they're still being talked about in terms of maybe how you slow down that production there? And do you coordinate with the Department of Defense at all? Could you touch a little bit on the whole poppy situation?
Sure. Clearly the situation in terms of poppy cultivation in Afghanistan has been a significant concern, and I think you're right that we've seen year after year increase in terms of poppy cultivation. And have some significant concern in terms of what that might mean. We are not seeing kind of widespread heroin trafficking to the United States from Afghanistan, but clearly as it relates to the instability within the country and the money that it generates in terms of the insurgency, I think that is a particular problem. We work with the Department of Defense as well as the Department of State in terms of looking at how do we continue to aid counter-narcotics efforts in Afghanistan. Clearly, the next few months, in terms of the election there, as well as kind of what are going to be resources after troop pullout, has a particular concern in terms of looking at those issues of both poppy eradication, but as well as alternative development to take the place of those poppies. That said, it doesn't diminish in terms of what we're anticipating for our counter-narcotics efforts. We are looking to continue priorities that provide training and technical assistance to the counter-narcotics police of Afghanistan, as well as vetted units within the Afghan drug law enforcement. As well as investing in institutional sustainability and capacity building within the Ministry of Counter-Narcotics. So these are largely efforts through our Department of State and their International Law Enforcement Division. So clearly this is an issue that is of significant concern for us now and going forward.
Well, thank you. And let me now ask you about a more domestic problem, that's methamphetamines. And as I understand it, it's very addictive. It's cheap. It's kind of becoming the drug of choice. And maybe you could tell us what you see the trends are in terms of the use and abuse of that. Talk about what you all are doing to try to counter the production and the use of that. And then do you need anything more in terms of tools that you can use? Because as I understand that's really one of the most serious things we're facing today.
Great. Thank you, and I appreciate the offer. So, as we indicated, we've seen significant increase in seizures of methamphetamine at our southern border, as well as an increase in domestic production. And some of the programs that we have from the law enforcement that we've talked about previously through our high-intensity drug trafficking areas. We also have a national program under our HIDA program, and that's the National Methamphetamine and Pharmaceutical Initiative, and that provides regional additional support through our HIDAs to look at how do we diminish drug trafficking and production issues, particularly for methamphetamine. Again, on the prevention side, we see a variety of resources, our drug-free communities, to look at doing that. I'd be happy to have subsequent conversation with you in terms of what additional things might we have in place that beyond just the Combating Meth Act that might hold promise in terms of reducing the availability of some of the precursor chemicals that go into methamphetamine production. As Congressman Graves pointed out, as we've made changes at both the federal and state level, there's been, I think, an evolution in both chemicals and production that warrant, I think, additional consideration in terms of how do we continue to do everything that we can from both a supply reduction and a demand reduction standpoint to reduce those issues. I also think, too, that when we look at methamphetamine, that we have some significant parts of the country that are more affected than others.
Yeah, I was going to ask you about that. What are some of the, these meth labs that you read about, they kind of come and go, where are they going? Where are they concentrated today?
I think that the biggest impact that we see in terms of methamphetamine, and this is not to say that we don't see it in rural pockets around other areas, but when you look at kind of the regional impact, I think that is particularly in the South, and the West is where we see significant impact for methamphetamine. I came from the Northeast, where we had a big heroin problem and very little meth problem. So we have different parts of the country that I think are differentially impacted by methamphetamine, both in terms of production and use.
Is it hard to set up a meth lab? I mean, like you go to Colombia and see it's pretty, you go out in the jungle and make cocaine. I mean, how do you, is it something somebody can set up, make meth, and if somebody comes, they go somewhere else? Or, I mean, how complicated is it?
In the spirit of full disclosure, I don't think I'm really fluent, other than watching Breaking Bad. I don't think I don't think I really know the technical capabilities to do it. My understanding is that it's not tremendously complicated, and I think that's why we're seeing the development of some of these one-pot labs in terms of both the chemicals that are available as well as the process. That said, I think the most people who are doing production are not necessarily tremendously skilled at it, and I think we see some devastating environmental impact, drug-endangered children as it relates to it. So, I don't think that it's technically tremendously difficult to do. And again, I think as we have put certain controls on certain of the chemicals, precursors, that we've seen the evolution in terms of...
Is it, would you say, is it the fastest growing? I mean, it used to be crack cocaine. And I mean, how does meth rank in terms of abuse and potential for abuse? And because I always understood it's just so cheap and so available that it is one of the fastest growing problems you're facing.
I think, one of the things, and again, I think we have to continue to monitor the impact of the production, because what we've seen, quite honestly, over the past several years has been a reduction in meth use. And again, that is probably differential in different parts of the country. But we have seen some decline in methamphetamine use. I think we would be well advised in terms of looking at both the production and the interdiction around our meth use, as well as some early indications that we're seeing more emergency department mentions, an uptick in emergency department mentions for methamphetamine. So I think we have to pay close attention on both a regional and a national level in terms of those issues. One of the issues that we talked about before, I think in terms of magnitude of order, has been the prescription drug abuse and the opioid epidemic that we're seeing nationally. So those, that is clearly an issue that is a high priority for us, as well as continuing to monitor what's happening with other drug use trends.
Gotcha. Mr. Serrano.
I'm not doing well today. Either you're asking my questions or he's answering my questions before I ask them.
I hope it's the latter, Congressman.
It's both. It's both. So I wanted to talk to you about the prescription drug abuse. What are you specifically proposing to do to reduce the misuse of the prescription drugs? And also, how have past efforts, what have they shown, and how do we integrate them into what we want to do now? And lastly, I know there are 49 states that have laws authorizing prescription drug monitoring programs, or PDMPs. Are they all functioning, or just some of them?
Sure. So In 2011, ONDCP coordinated an interagency effort among our federal partners and released a plan to reduce prescription drug abuse, and that has four main pillars. One is education, educating prescribers, and what we've seen is as the number of prescriptions for prescription painkillers has increased, so has the consequence of doing that. It entails proper monitoring, as you alluded to, making sure that we have good prescription drug monitoring programs. It requires and focuses on safe disposal. One of the things that we see is, particularly for occasional users, about 70% of people who use those medications occasionally are getting them free from friends and family. So how do we get those drugs out of the supply chain? And so we're working on safe disposal. And then the last one is around good laws to make sure that we are eliminating pill mills and doctor shopping. As you talked about, one of the central components of what we've been proposing is making sure that we have good prescription drug monitoring programs. And, we have 49 states that now have prescription drug monitoring programs and have been working to make sure that all of them are implementing best practices in terms of those. And I think, there's probably no better example than what happened in Florida that had Congressman and I were talking about this in terms of implementing strong prescription drug monitoring programs and enacting strong legislation. And what we've seen in Florida is a significant decrease in the number of prescription painkillers, and I think probably most importantly, a significant reduction in drug overdose deaths associated with those. So clearly having vibrant programs are important to us, as well as having programs that share information across state borders to make sure that as Florida implements good and sound policies, that people are not just moving to Georgia to focus on it. So it's clearly been one of the top priorities of our office in terms of this whole of government effort across our federal partners to minimize the impact of prescription drug abuse.
Yeah, I should tell you that on social media this afternoon, after announcing that I would be attending this hearing, the number one question asked by about 6 or 7 people, which is usually an indication of many others who want to ask the same question, was about the overdose issue. And so with that in mind, I'd like to get you on the record just for clarification. When we talk about prescription drug abuse, are we talking about all prescription drugs, or are we basically saying that the problem is painkillers?
We're chiefly talking about prescription pain medication. That's really the issue.
Because people who are on, for instance, cholesterol medication or high blood pressure, they're on for the rest of their lives.
And I think we want them to probably stay on those medications.
Exactly.
I think the concern is particularly that physicians get very, very little training around the risks associated with these very powerful pain medications, as well as little training on how to identify substance use disorders in their population. So that's why prescribing, and particularly mandatory prescribing for physicians, is really important to the work that we do. As you indicated, the magnitude of the drug overdose deaths is really astounding to our office. And, in 2010, we had over 16,600 prescription pain-related overdose deaths in the United States. That's 100 people a day who are dying from prescription pain medication overdoses. And our office has been working with federal, state, and local folks to implement naloxone distribution programs. And naloxone is a very safe, effective, non-toxic substance that emergency responders have been using for decades to reverse an overdose. And we've been very heartened in terms of the number of states that have enacted naloxone distribution programs throughout the country. It's really remarkable. It's a really miraculous drug in terms of its ability to save lives.
Let me ask you one more question, and then, Mr. Chairman, if we don't have another round or anything, I'll just submit a couple of questions for the record. We know we don't have diplomatic relations with the island of Cuba, but in the past we've done immigration work with them. In fact, we do immigration work ongoing. We've done transportation issues in terms of airplanes flying over or not flying certain parts of the Caribbean. We've done hurricane issues, preventing tsunamis or warning of tsunamis and so on. Do we have any kind of relationship when it comes to drug issues with the Cuban government?
To my knowledge, sir, I don't think we have any ongoing discussions or work with Cuba, but would happy to discuss with you and your staff kind of what you might be thinking.
Okay. Because I know a couple of years ago, to my shock, they were willing to accept DEA agents on their turf, if you will, and political pressure from this country stopped that from happening. And I said I was shocked because, basically saying send me agents from your country, of any kind of agents, to Cuba was quite a statement. And I know it's not in their best interest to have drugs coming into Cuba, and it's not in our best interest to have drugs coming here. So I'd like to know if you know later on, if you can find out if there's been any talk about that in the near future. It's probably one of the areas where I think both parties could agree would be of benefit to this country.
Happy to look into it, sir.
Thank you. Thank you, Mr. Chairman.
Thank you. Mr. Womack?
Thank you, Mr. Chairman. Mr. Botticelli, your predecessor, I think, was confirmed at CBP earlier this month?
Correct.
Is that right? So you've been in your current capacity now as acting director
2 weeks now.
for 2 weeks, okay. Is it fair to say that you didn't have a lot of input with the president face-to-face on this particular budget?
Clearly we work with the administration and through the...
But you personally, you
Right.
personally were not face-to-face with the president on this budget?
Correct.
Okay. Have you been invited into the White House, into the Oval Office, to talk about the growing problems with substance abuse and the effects, the cascading effects across society? Have you had an opportunity? Have you been invited? Have you had the opportunity? Can you kind of take me inside the White House and tell me how that conversation's going?
As part of the executive office of the president, we obviously work with the president and the president's advisors in terms of what our policy has been. And
I'm talking about specifically the president.
I have not, sir.
Have not. Have you been invited?
I have not, sir.
Okay. $311 million is the budget for the president's budget for your office?
For our office.
Down from 370, 360. Was it 55 million? Was that the difference?
Correct.
Okay. That's about a little less than 20% cut. I'm going to guess about 17.5%, 18% cut in your budget. Do you think that's an adequate reflection of the importance of your office, given the fact that you're taking the better part of the 20% cut in the president's proposed budget? Do you think that's a reflection of the priorities?
I think not just looking at our budget, but if you look at the totality of the national drug control budget, right? So not just ONDCP.
Which is 20-some billion. I mean, it's a lot of money.
And so if you look at kind of the totality of the resources that the federal government has in terms of looking at this issue, we've seen that money increase. And I think what is particularly important in terms of the overall national drug control budget is that we've seen a significant increase in terms of our drug prevention and drug treatment services. And again, that if you think about priorities, that we're looking at how do we deal with this as a public health related issue. And so those dollars have continued to increase in terms of our overall federal budget from a priority. So I think, Congressman, when you look at the entire national drug control budget, you see that it is a priority within the administration.
Well, I was reading in your statement that, and these numbers just kind of shocked me to my conscience on the fact that drug overdose deaths now number greater than motor vehicle crashes and greater than gunshot wounds. And so, pertaining to the latter, I've sat in a lot of meetings, including the State of the Union address, where the president talks about pulling out his phone or his pen to do things that Congress is unwilling to do, and he did spend some time talking about school shootings and large-scale casualty operations resulting from guns, and this immediate desire to want to do something about gun violence, and yet we're going to cut this particular budget, even though it's the office's budget, by almost 20%, and the number of deaths related to drug overdoses in this country is greater than the gunshot wounds. So I want to ask again, is this a reflection of where this fits in the national priority as it concerns the administration? And what are you doing, and what do you plan to do? Because I'm going to give you a break here. You've been there 2 weeks. You've been there since 12, but in your capacity for 2 weeks. What are you going to say to the President when you have that face-to-face meeting on the policies of this administration as it concerns something that now outnumbers, drug overdoses, now outnumbers gunshot victims?
I think, again, when you look at some of the new additions and the proposed 2015 budget items, that there are some additional items included in that budget that are specifically focusing on the opioid abuse and the overdose epidemic. So our Substance Abuse and Mental Health Services Administration has an additional $15 million to get out to states and local communities to particularly focus on prescription drug abuse issues and opioid and overdose issues. Contained in that budget is also an additional $10 million for the Center of Disease Control, again, to support state-level actions as it relates to overdose prevention. You know, it's clearly been a priority for our office in terms of promoting overdose education. We worked with a number of federal partners and non-governmental partners in terms of continuing to raise awareness around the magnitude of the opioid overdose issue. So, you know, again, I think that, you know, one of the areas that we see that leads to overdose is untreated addiction. And one of the biggest causes of why people don't get treatment is a lack of insurance. And one of the areas I think that the Affordable Care Act contains is a provision to make sure insurers have to include a benefit for substance use disorder treatment. And that's reflected in the President's budget. So I think if you look at, again, the commitment to not only expanding access to treatment, but specific vehicles to enhance state-level efforts to reduce the magnitude of the burden, I think that we see some promising proposals.
I thank the gentleman.
Thank you. Mr. Diaz-Balart?
Thank you. Actually, I was listening to you before, sir, and you were talking about Florida. You know, we would be remiss without thanking Chairman Rogers for remember how he was so aggressive about the pill mills, and Florida had frankly a huge issue there, and so that was, we've seen some good results of that. Let me just throw in another issue which I know very little about, which is this issue of synthetic marijuana. I saw some things in newscasts recently. I guess there have been some deaths, and I know that our Attorney General in the state of Florida has been very aggressive, and as the formula's changed, she's constantly looking at just trying to update that legislation, which is obviously much quicker on the state level than it is here on the federal level. Tell me a little bit about your thoughts about that. Is that, how big of an issue is it, and you know, what's your thoughts on that? And then the second question, well, let me just go for that one first, and then we'll...
Sure. So the issue of synthetics has also been a significant concern for us in terms of a number of different areas. So one is often people don't know what they're taking or what they're getting when they take these chemical substances. There's certainly not a consistency in terms of products, in terms of how they're using it. So we've seen some significant issues around those areas. And so it's really been an issue that we've been trying to kind of focus on. And, you know, clearly we've been working with our partners in the DEA in terms of how do we, trying to stay on top of scheduling some of these substances. But Congressman, quite honestly, that's been really difficult because as we continue to schedule more and more of these substances, the chemists always seem to be one step ahead of us in terms of making kind of small tweaks to some of these chemicals to elude some of the scheduling processes. So we've been actually working with the DEA and with the Senate Drug Caucus in terms of are there things that we can continue to do to stay ahead of some of these scheduling issues as it relates to some of these synthetic drugs. We've also seen and have been having conversations, you know, as states and as federal government has implemented strategies to reduce the sale of these, we see the internet playing a larger and larger role in terms of where people are getting the substances from. So we've been actually engaged with payment processors some of our large credit card companies as well as PayPal to see to what extent can they share information with us as it relates to some of these internet sites. And they've been, to this point, I think, concerned about the issue and willing to work with us in terms of some of those sites. So it's been an issue, again, that we continue to look at in terms of those priorities and look at how we can continue to stay on top of some of the emerging issues.
And I'm assuming because the states do have, I guess, an advantage as far as just at least quickness, right?
Yes.
Of dealing with some. So I'm assuming that you are, I mean, how good is your cooperation with states? And I guess that's kind of a general question. I'm sure there's some are better than others, I would assume.
Part of the one of our components in ONDCP is our Office of State, Local, and Tribal Affairs, and they work pretty closely with our state counterparts, both in terms of law enforcement and public health, to look at things like model legislation and model work and sharing best practices among states. So we actually have I think, a very good relationship with many of our state counterparts on both the law enforcement and public health side.
If I may, Mr. Chairman, you've been very patient with me. I'll be quick on this one. When going back to the issue of how the Attorney General and the administration is going to be kind of monitoring what's going on in Colorado and elsewhere, as far as you know, is that a informal monitoring? Is there a metrics? In other words, is there a system set up so that they can look at, compare data, et cetera, or is it more of an informal monitoring that they're going to, and if it is a system that's already set up, the metrics, it'd be good if some of us, I'd be interested to see it, and also, how long it's going to be, et cetera. What can you tell me about that?
Sure. So our office actually took the lead in convening some of our federal partners, and we looked at each of the 8 Department of Justice criteria as they laid out, and looked at what are our data sources, and most of these are publicly available data sources that speak to things like diversion to youth and treatment admissions, things like drug driving and arrest. So we will continue to monitor with our federal partners those data to look at the picture of what happens with Colorado and Washington.
Thank you, Mr. Chairman.
Thank you. Well, I have some questions that I will submit for the record. I know Mr. Serrano does as well. So let me just say in closing to thank you and your staff for what you do. We talk about this fight against drugs, and we refer to it often as a war against drugs. And some people say we're winning, some people say we're not winning, but we're certainly fighting the war. And drugs, as we all know, have such a terrible impact on our country, whether it's destroying lives, breaking up communities and families. So we want to work with you and your staff to try to win this war, to keep America safe, to keep it healthy. And thank you again for being here today, and we look forward to working with you. So this meeting is adjourned.
Thank you.